TVC News correspondent Kemi Balogun joins us now for more details on this. Kemi, how much of progress have this 12,000 community informant recorded so far in discovering the missing cases?
Well, this program that was, implemented by the World Health Organization started this year, early this year, and so far in the couple of months that it has started, they've actually done a lot of surveillance. They've brought out a number of cases and detected and tested and also treated, put many on treatment. Now, the key to this is the fact that the communities where people reside, they hardly know that they have tuberculosis. So most of the time, people just keep coughing and they don't know that what they have is actually tuberculosis. And once this thing starts, it starts spreading as well. So you can imagine one person spreading to 10 to 15 people, and then part of that 10 or 15 are also spreading to another 10 and 15. So it keeps growing in numbers. So the real aspect of finding all these community health workers is the fact that they need to be treated right there, even in the communities. And that is why these key players want to bring in methods whereby from the communities you have healthcare facilities that are centered there that can immediately start treatment, because most of the time treatment is like it takes a couple of months for everything to clear out. So it's a phase-by-phase treatment plan. So which means once these cases are found, they need to be put on treatment immediately. And so far it has actually started, getting a little bit of positive feedback that people are being found, and the numbers might just reduce very soon.
All right, we know that the issue of health is one major challenge in Nigeria, which stakeholders have been seeking government intervention in. How does this partnership hope to work with the government and other stakeholders to ensure that these health facilities they are looking at establishing in each community actually comes to be?
Basically they need, apart from the fact that they need the healthcare facilities in the communities, they also need the government to help with funding, because this is very key in ensuring that they get the gene expert machines. The gene expert machines are machines that they use to easily detect tuberculosis in these communities, because it's portable enough to be carried anywhere. So one of these things that they need is that gene expert machine, which is it costs a lot actually to get. So the funding from the government and also the key players coming together and also increasing on funding will help to further push the need that, and to also further push the program that and change the effects of the fight that they are actually doing at the moment. So government is really key in ensuring that this works out, because communities need awareness and government needs to push this awareness more or less.
All right, we hope that we can make real progress with this, discover these missing cases, and nip this in the bud. Thank you very much, Kemi Balogun, for speaking to us on TVC News at 7.